Autism, symptoms and signs. Through a medical lens, autism spectrum disorder, or ASD, is categorized as a lifelong neurodevelopmental disability. It is usually diagnosed in early childhood and can affect children's communication and social interactions. Some people diagnosed with ASD engage in repetitive or restrictive behavior that can impact day-to-day situations. Everyone with ASD is unique, but there are some signs or symptoms that are more likely to lead to a diagnosis. If you have found this video, you likely have questions about what causes ASD, the impact of an ASD diagnosis, or questions about neurodiversity. I'd like to take a few minutes to share what I've learned in my practice as a behavior analyst. What causes autism? The truth is, no one knows exactly what causes autism. What we do know is that ASD is most likely a combination of genetic and environmental factors. How do we know that genes play a role? Well, one example is that we see higher rates of ASD in twins, and a person is more likely to be diagnosed if they have an immediate family member with an ASD diagnosis. Scientists have found that certain gene changes, gene combinations, and genetic conditions can make a person more likely to be diagnosed with autism. While many genetic studies are looking at isolating these factors, there is no single biological test that doctors can complete to identify markers in blood or DNA samples. And what about the environment? Evidence points to several environmental factors such as prenatal exposure to certain drugs or chemicals, complications at the time of birth, or advanced parental age at the time of conception. None of these have direct causational links, rather correlational support. That is, we see patterns and there appears to be a relationship. What we know for sure is that vaccines do not cause autism. Parenting styles or maternal attachment do not cause autism. We know that autism does not discriminate and can affect people of all genders, races, ethnicities, nationalities, and socioeconomic backgrounds. So, what early signs or symptoms might you see? Early signs or symptoms. You may be familiar with people talking about autism existing on a spectrum. This means a person's presentation or behavior can vary in terms of impact across several key areas. For example, some people have trouble with social interactions and communication. They might have difficulty understanding body language or maintaining a conversation. Others might have repetitive behavior or be intensely focused on certain interests. Simply put, autism doesn't look the same for everyone. Everyone experiences it differently. So here are a few key responses to look for, either in yourself or for your child. Social challenges. Your child may avoid eye contact. They may have yet to respond to their name, or they may show little interest in people or toys. Communication difficulties. Look for delayed speech, where your child might not repeat words without showing an understanding of them. They may not use gestures like pointing. Repetitive behavior. This takes many forms. For some individuals, this may be an increased sensitivity to lights or sounds. Certain environments or situations can impact a child's tolerance, flexibility, or adaptability. Sometimes this means children develop very specific interests or engage in repeated responses like lining up toys or hand flapping. Sometimes this means it's difficult to leave a situation where a child is very engaged and transitioning to another activity can be a challenge. If you're considering exploring the diagnostic process and you're concerned about what signs exactly to look for, here are a few to keep your eye out for. Watch for signs such as not smiling at others by 6 months, not using gestures to communicate or babbling by 12 months, not speaking single words by 16 months, not speaking 2-word phrases by 24 months, and finally, not reacting to voices, sounds, or their name. Identifying autism and neurodiversity. These signs don't confirm autism, but they suggest you should check with your healthcare provider. According to the CDC, just a little over half of children who receive a diagnosis are diagnosed by age 4. Older children and adults can also be diagnosed with autism. In some cases, later identification is a result of limited resources. For people with strong language skills, or those who have learned to blend in, suppress, or mask their behavior, a diagnosis may come later, as a teenager or even adult. Some people identify as autistic, and others prefer person-first language, a person with autism. For some, an autism diagnosis is the start of a journey, perhaps on a different path than they thought. For some, an autism diagnosis helps to create a sense of belonging and provides relief or a context for their lived experiences. At Learn, our practice is informed by acceptance and neurodiversity. Our approach is child-centered, innocent-based. While the behavior analytic approach is rooted in the medical model of autism, our analysts have training on the social model of autism and embrace the opportunity to learn about neurodivergent perspectives while maintaining a safe, supportive environment for children and families to thrive. Our goal is not to change who a person is following a diagnosis, but to work alongside children and caregivers to help them be the best version of themselves. Here at Learn, we are committed to helping your child and family find success at each step of your journey. Follow along with our YouTube channel and find helpful tips and content each month. Please leave a comment below to share your thoughts or experiences. Leave questions or suggestions for other topics.